well, whether it's a crown, an implant, or a bridge, dental work stays with us for life.
And more of those materials are now imported from places like China and Mexico. As I-Team reporter Ryan Kath explains, countries with no rules or safeguards about the items that could go in your mouth.
This is a prosthesis that's being made for dental implants.
For 3 generations, Dickerman Dental Prosthetics in Sharon has made quality a priority.
Crowns, bridges, partials, dentures, a night guard for someone who grinds at night.
It's precise work where millimeters matter. Ira Dickerman is concerned patients might be getting work put in their mouths that isn't up to those standards. It's now estimated up to 40% of these devices are imported.
They're coming from Mexico, Costa Rica, the Philippines, China, all over the world.
There's no FDA oversight. The Federal Drug Administration does not monitor the lab work coming in from other countries.
Dr. David Samuels is the chairman of the state's Board of Registration for Dentistry.
There's certainly concern that the metals could have lead in them. That's not a substance that you would want in your body, or other even carcinogenic materials.
And it's not just imports that don't get scrutinized. The I-Team found 10 states have put in place some type of safeguard for labs here in the U.S. Massachusetts isn't one of them.
You could set up a lab in your house. Many of them are set up in garages and basements.
So here in Massachusetts, there really are no regulations?
You need to have a license to cut hair, but you don't need to have a license to create a restoration that's going in a patient's mouth.
High tech and hygiene go hand in hand at Straumann USA in Andover, where they do state-of-the-art dental manufacturing. Company Vice President Steve Sheehan says many reputable companies have industry certifications, but he still thinks government should get involved.
There needs to be a certain amount of traceability to the products if something goes wrong. There's issues of warranties when you're talking about a product that fails.
Dr. Samuels told the I-Team he'd like to see the Board of Registration develop standards for labs.
I think the labs would benefit, I think the dentists would benefit, but most importantly, the consumer public would benefit as patients.
In the meantime, experts say it's a good idea to ask your dentist if they know where their products are made and if they use a lab certified by an industry trade association. For the I-Team, Ryan Kath, WBZ News.